Public health authorities exist to promote and protect the health of all citizens through education, prevention, surveillance, and response.
Public health really has two roles in regards to ESF-8. The first role is to lead the initiative with those community partners to ensure that there's a plan in place prior to an incident.
To this end, public health is constantly focusing on the overall ESF-8 disaster planning process. This involves everything from coordinating regional ESF-8 planning meetings, training, and exercises to developing educational materials and other resources.
The second role of public health is that response to a disaster, which could vary from giving immunizations to passing out pills to ensuring that the groundwater is clean and able for those people in the community to drink.
Public health departments are responsible for developing and coordinating response plans for all of these capabilities. Public health's role in a disaster is often complicated, and it can vary considerably depending on the specifics of a given situation.
Depending on the disaster, public health might have a lead role, and an example of that would be a pandemic or a disease outbreak. However, on the other hand, public health might play a supportive role in supporting other responders and their recovery efforts of the disaster.
In a disease outbreak, public health takes the lead and implements many steps to help stop the spread of the infection. This could include implementing quarantine and isolation, issuing health advisories, and dispensing medications through points of dispensing called pods. When a disease outbreak becomes critical, public health departments can access the Strategic National Stockpile, which is a repository of vaccines, antidotes, and other supplies which can be on hand within about 12 hours. In other types of disasters, the tasks which fall to public health include such things as ensuring the continuity of healthcare services, monitoring air quality, water quality, and sanitation, assessing the needs of special populations such as the elderly and disabled, promoting injury prevention and hazard awareness, making sure food in a stricken area is served at the proper temperature, monitoring waterborne pathogens, and many other critical tasks.
I think during a disaster, if you look at other ESF-8 agencies, they're serving individuals. EMS, hospitals, they're all treating people at the individual level. Public health's role and responsibility, not only during a time of disaster, but just every day, is to treat the community and to treat the entire population for health and medical needs.
These folks are the ones that have the expertise in dealing with health, major health issues. These are the ones we turn to help us with that expertise. That's why they play such an important role there in our Emergency Operations Center, because they're the ones we can turn to and say, okay, what do you suggest that we need? What type of specialized things do you recommend for us?
Under ESF-8, public health is charged with a number of specific responsibilities, one of which is managing proper debris disposal. A destructive disaster also brings with it mountains of debris, all of which needs to be sorted and disposed of properly.
There was just a lot of stuff to get rid of in Greensburg. So part of what public health was doing was helping be that contact person between the local county commissioners, local people there that was needing to move whatever needed to be moved, whether it was wood from the houses or if it was chemicals from the bathrooms.
Sharp hazards like nails, metal, and glass create the potential for infection. So one of the first priorities is setting up an area to begin administering tetanus shots.
We would ask people, how long has it been since you've had a tetanus shot? Most of them said, I have no idea, no idea.
Flooding is the nation's #1 disaster in terms of loss of life and property, and represents significant challenges for public health.
A number of times we've had major flooding situations where they're playing a background role and they're out there keeping track of the health of people that are out working in the field. They're the ones that are bringing in all the vaccines, the tetanus vaccines. They're the ones that are setting up the shot clinics to inoculate the folks out there.
Public health also plays a critical role in communicating important information to responders and the general public alike.
The last incident that we had, they put together flyers for us to give out to people of, here's what you need to, here's the things you need to think about, here's what you need to be wearing, and here's where you can get your tetanus shots.
People in a disaster often don't have access to electronic media.
And so we have emergency response vehicles that go in and throughout the affected area that can help pass those messages along of, do you know that there is a site being opened up where you can go and receive a tetanus shot or medication for whatever the situation is that arises.
In addition to trained and certified nurses, many health departments in Kansas oversee the Medical Reserve Corps program. The MRC works to pre-credential medically licensed and medically trained volunteers who are able to respond to a disaster. In many cases, these volunteers are able to be deployed across the region. Another key resource that public health brings to the table is epidemiologists who, through disease investigations, can tell us much about the situation at hand. In this effort, public health may work closely with environmental health and other response agencies.
Well, if asked to collect data, we would collect the hazard data, the accidents, the illnesses from the shelters, from EMS, from the hospital units, from the public, and we would then share that with somebody that would be designated in the role as being an epidemiologist. And they would then put those individual numbers together to develop a picture of the health of the disaster.
Some of the things that epidemiologists do are track the disease, where it originated. They also can help identify the disease if we don't know what disease it is. And they can also help identify the appropriate course of action that we need to take to stop the spread of the disease.
Not every community has a medical reserve corps or the same level of personal protective equipment. In some counties, the same person may wear both hats of public and environmental health.
I think one of the things that's important for people to know about public health is that because of the broad spectrum of response efforts that we can provide to a disaster, it's important to work with your local community to know what their resources are and what their limitations are and how they can help best serve you and other agencies in your community.
To learn more about public health and their response capabilities in a disaster, please refer to the resources that are provided with this video.